This is New Day Northwest. Now, here's Margaret Larson.
See how that works. Plus, we'll explore an approach to health and beauty that concentrates both on inner health and outer beauty. Our medical professionals will gather to answer your questions a bit later in the show. But next up, a one-stop solution to take care of yourself inside and out. We'll be back in just a moment. Welcome back, everybody. Busy women are always looking for ways to streamline their schedules and appointments to make time for work, family, errands, the whole thing. Well Medical Arts in West Seattle can help, offering services aimed at inner wellness and outer beauty in one stop, one location. Registered nurse practitioner Dominique is here to share her two-step approach to wellness with a variety of services and procedures. Welcome. It's nice to meet you. How you doing?
Great. Thanks.
I was really pretty fascinated to read your backstory, you know, how you arrived at what you're doing now. Can you give us the recap?
It started when I was a kid. I was in a serious car accident, and I fell in love with health, healing, the human body, and besides modern medicine and my wonderful surgeons, really got better through vitamins, nutritional therapy, good old prayer and meditation, and that started me on my path in medicine. I became a nurse practitioner, and through years of seeing people in family practice, noticed that a lot of the things that I saw were either stress-related disorders or behavior-related problems. Yeah. So started working on behavior modification, setting up programs for people where we set realistic, measurable goals with reward systems.
Which makes sense to me, the idea of seeing the whole person. You're not just a liver or a nose or whatever you went to the doctor for. You're, you know, a whole person. And I was so struck by a doctor recently who said that 50% of the things people go to the doctor for, chronic illnesses, are lifestyle related. In other words, they're things that we've kind of done to ourselves, and I don't mean that in a shaming way. I just mean that we could undo them or reduce them or try not to do them to begin with. And so your idea is to kind of bring all that together in one place.
That's what I love working on people with. So my vision was to have a wellness center. I started writing about it and did a little vision board for it, and within months some fellow called me up and said, "Hi, my name's Skip from Avanti Skin and Wellness, and we're looking for a nurse practitioner to help launch our wellness division." So I helped them open 3 clinics in Washington, 2 California, 2 in Utah, and then eventually made a business plan and opened up my own.
That's great. And so what do you do at this location now?
So we do a combination of inner health and outer beauty. So when I was working for Avanti, they cross-trained me in aesthetic medicine, and I went and got certified by the American Academy of Aesthetic Medicine. This was right when I was turning 40. The face was falling. I was like, this stuff is great. I love it.
It's a good time to learn about these things, right?
Right. So I call it the fun medicine. Inner health and outer beauty. So for the inner health, I do testing for vitamin deficiencies. Then when I find deficiencies, have my own line of nutraceuticals, which is a prescription strength pharmacy grade supplement. We do testing for hormone imbalances and the bioidentical hormone replacement therapy, internal cleanses, weight loss, trying to keep cardiac risk factors down, vitamin B shots, stuff to keep us healthy as we're aging, and then all of the cosmetic dermatology. I take a less is more approach. We do the injectables, which is the Botox and the fillers, the lasers, the prescription skincare. Keep us looking good.
After you've gotten healthy, then you can sort of examine what else needs work, right? And you do something called Ultherapy, and so we have some pictures of that. And is this relatively new? Because I have only recently heard of this. What does this work on?
It is. It's fantastic. It's the latest skin lifting device.
I am all for that. Let's see how this happens.
FDA approved, non-invasive, using ultrasound. So the ultrasound comes down, it delivers the heat, and then your body stimulates its collagen, reorganizes the collagen to strengthen it, and then the skin is lifted.
And so that's really what we lose as we age, right? The collagen sort of falls apart, and you get
elastosis.
I'm trying to find nice words for this, but you know, things that we don't want to have happen. So does the Ultherapy hurt if it's burning something? Does it hurt you?
It's different from person to person. I loved when I had mine. We did underneath the neck, the face, a little bit of a brow lift, and when they did it, 0 to 10, 0 is none, and 10's the worst of my life. I only thought it was about a 3, 3.5. Other people may give it a little bit more, but absolutely manageable. So we're laying down little rows of energy with the heat, and if it gets a little warm in one area, you just move it over to another. So very manageable.
So you're perfectly awake to say, ow, let's move.
It's so
okay. Just checking. Okay, before and after, let's take a look at how this works. Wow, because see, this is an area everybody thinks is a drag. I know I do. You know, that under your chin, you try, but you know, aging is largely genetic in this area of your body, right? So how, was this just Ultherapy that produced this result?
Yes, so there's not many things that can address under the neck, the neck, and the lower face without a facelift. So this is why this is so fantastic. It's going to be able to serve a large group of people that don't have a lot of treatment for that area non-surgically. One treatment is all it takes.
Now, I've read that different people respond differently to this. Do you have any idea when somebody, because you know, nobody wants to pay for a procedure and not have it work. Do you have any idea when patients come in whether they are likely to get a good result?
The majority of patients who have done it are happy. It's considered the #1 treatment according to New Beauty right now because it is making a lot of people happy. But of course, the more sagging that you have, the more you're going to need more lifting. The more volume loss that you have, the condition of your skin, your lifestyle, whether you're a smoker, different things are going to affect it. But people who are younger are getting a really super great, and even people who are surgical candidates who could use a lot of work are very happy with the results they're getting too.
I may just start sleeping upside down and see if that helps. So you have a special on this going on right now. Can you tell us about that?
We do. So right now, there are many different areas of the face that you can do. The brow lift, around the eyes, the face, the neck. It's 25% off for all of the King 5 viewers.
Great.
Any of you who want to come try it.
Fantastic. It was lovely to meet you. Thank you so much.
You
I
too.
love your approach with the holistic idea about all of us. To learn more about Dominique and Well Medical Arts, please visit our website. We've also posted her generous offer online, as well as the best way to contact her for a free consultation. She'll be back in just a moment to take part in our wellness panel discussion. So if you have questions, please send them in. Throughout the show, you've been submitting questions. Today's Wellness Wednesday panelists are here now to help answer those questions. Please welcome back Dr. Jeffrey Tyson from Northwest Pain Management Associates, Melissa Lubati from Evergreen Health, and Dominique Well from Well Medical Arts. Thank you all. Appreciate it. So, Dr. Tyson, we're going to start with Candace in the audience who has a question for you.
What's the difference between your device and a TENS unit?
TENS units, TENS stands for transcutaneous electrical nerve stimulation, a big long word. Basically what these devices are patches that get put on the skin and have an electrical current that goes onto the skin to create a tingling on the skin to kind of fool your brain into thinking that something else is going on. That's where the similarity between these devices and the implantable spinal cord stimulation system stop. They both use electricity, and that's about it. With the spinal cord stimulator systems, we're actually interrupting the pain signals themselves, not trying to kind of confuse them from the outside. A lot of the patients that we see have already tried TENS units and it didn't work, which is why they end up coming to see us. So, but they both use electricity, and that's about it. The spinal cord stimulator systems tend to be very effective in patients where TENS didn't work.
Does that explain it for you?
Yes, it does.
We had another question about chronic pain, back pain. I mean, I think everybody has back pain to some degree or another, but chronic pain is one thing, and then some people have with is it the SI joint, other things that may happen very suddenly. If you have that kind of recurrent back pain, does this device do any good?
That would be considered an acute pain issue, and it wouldn't be appropriate to use this device for acute pain problems. Acute pain, by definition, is self-limiting and would go away on its own.
So with some kind of other treatment.
Right, and if it turns into a chronic problem, then what we would do would be some targeted diagnostic work to try to figure out where the underlying problem is and try to treat that first. If those efforts fail, then something like one of these devices would be appropriate.
It seems like there have been sufficient advances that we used to just say, oh, everybody's back hurts, you know, kind of live with it, but it's worth investigating.
Well, luckily that's not the world we live in now, and there's a lot we could do that we couldn't do even 10 or 20 years ago. The newest devices we're using are able to cover much larger areas with one simple device. For the types of problem that Lorelei had, up until about 8 months ago, we would have had to put in 2 separate devices. Now there's one device on the market that'll cover all areas.
That's great. Very interesting. Okay, thank you. Melissa, we have a question about hospice. Pets like Riley, what are you looking for in a dog and also their handler or owner? What characteristics, I guess I would say, personality types?
Well, they have to have the right temperament. They have to be comfortable around medical equipment and in a medical environment. And then as far as temperament, it's about basic obedience. And then also...
Yeah, I am so out, my dog and I, with the basic obedience. All right, sorry. And then in terms of personality qualifications for the owner, the handler, tell me a little bit more about the kinds of people who do best in this situation.
It's really about the relationship between the handler and the animal, between the two of them, because it's different than the relationship you have with your animal at your home. The rules and expectations are different when the dog is working. And so that defines the relationship between the handler and the animal a little differently.
Absolutely makes sense. And if you're thinking about this at all and you are personally interested but you don't have an animal, can you be paired with one, or do you need to come already as a package?
You don't have to own, it does not have to be your personal pet, but you certainly have to be tested as a team and evaluated as a team with the dog.
Okay, makes sense. Dominique, Sylvia in Bellevue asked about acne scars. She has a young teenager who has acne scars, and she's wondering if that's what you can do about it, and if it's something you do during teenage years, or do you wait until the acne years have, hopefully subsided?
First of all, yes, we do treat acne scars. It wouldn't be the Ultherapy, that's for skin tightening. First thing you want to do is control the acne, because we don't want to be creating more scars.
Right.
So first, the acne's under control. Then what we'll do is resurfacing. And there are different kinds of resurfacing. What we do is a CO2 fractional resurfacing. What we're doing is we're poking holes in the skin with light and heat, and it's your natural skin in between the holes that's regenerating all of the collagen, elastin, and giving you a brand new dermis. So yes, we absolutely can resurface after we get the acne controlled.
Okay, and is this something that you need to wait for, or she could go ahead and have this done, let's say, I don't know how old her teenager is, but let's say she's 15, 16.
As soon as the acne's under control, we can treat it.
You can go ahead. And then we had another question I thought was interesting. If you came in and you just had, a small amount of money to spend, what's the biggest difference you can make in your face for the least amount of money? That's a good question, isn't it? That was not mine, but I love that.
It really is. It really is. In a short answer, I'd have to say Botox.
Okay.
Then it's individual per face. So if somebody comes in and their main problem is that they've got these right through here,
right,
of course we want to do that so that they don't look angry. If somebody's face has lots of crow's feet, we'll go ahead and do the eyes. If somebody's mouth is turning down, we go ahead and do the angularis muscle to lift it up. So it really depends on the face, but that is the most cheapest, easiest, cost-effective, no downtime product.
And the thing of it is, you don't do all of that at once, right? You try to maintain a natural face by not freezing somebody's face.
Done properly, Botox will give you about 75% relaxation, and you keep like 25% range of motion. So you can still raise and furrow and do everything like natural, just not enough to put a wrinkle in. We encourage people not to do the whole face, but to pick a couple of areas that you want to work on, because the Botox lasts 3 or 4 months. So you're repeating it and keeping that muscle relaxed so that it eventually weakens and atrophies and can't put a wrinkle in. You don't want to do that to the whole face, just the areas you're having problems in. For example, the corrugator muscles or the angularis.
Man, you have to know every last bit of the anatomy of the face to do this, right?
It's fun.
I'm sitting here very still, trying to keep my face very still. Don't want any new wrinkles to occur while we're discussing this. Thank you all very much for being here. If you'd like to reach any of today's panelists, you can find their contact information on our website, and we'll be right back with highlights from this week's Fierce competition.